Hello guys, welcome to our YouTube channel. Today we are going to talk about the ways on how to treat or reverse the diabetes type 2, and today we have our health instructor here. Her name is Celestine. She will take us through maybe so that we can know on how to control and treat this diabetes type 2. So Madam Celestine, what do you have for us today?
Thank you so much, Brother Sharif. With me here today is how to reverse or how to treat diabetes type 2, as my brother just put it.
Okay, Madam Celestine.
Yes.
Maybe you have told us about diabetes type 2. Maybe you can explain to us what is diabetes type 2, because there are people who doesn't know what diabetes type 2 is.
Okay. So diabetes, they are in three forms.
Yes.
So we have diabetes type 1, which is especially during childhood, viral infections and other childhood infections lead to type 1. We also have type 2, which is especially for the grown-ups or the aged, which is usually caused by the sedentary lifestyles. There are lifestyles we assume to be modern, which affect us in a way that the blood levels or the sugar levels in our bodies imbalance. That is why this type 2, we use our nutrition to reverse the same type 2 diabetes, which is the type 1 to look at right now. We have the type 3 diabetes, which is inherited. A father to the daughter, a father to the son, etc. So for us to get about this type 2 diabetes, as we've really understood that it is caused to the lifestyle we are leading. So most of this lifestyle is too much fat in our diet, too much sugars in our diet, too much salt in our diet. That is why our ingredients to reverse type 2 diabetes include AC, which is the activated charcoal. We have warm water. We have protocol juice. You may not understand what is protocol juice, but it's a simple procedure for you to acquire protocol juice. Take a quarter cabbage, 2 tomatoes, 2 carrots, 2 cloves of garlic, 2 cucumbers, 1 red onion, one type of leafy vegetable. It can be spinach or any other. Blend them as one. The juice produced, that is what we call protocol juice.
Okay.
That's now one of the ingredients. We need herbal tea. Herbal tea is a mixture of milk thistle, paddock, dandelion, fenugreek leaves, moringa pods. So for you to treat, since it's a nutritional disease, we need our nutrition to treat itself. So we need herbal therapies for the same. For instance, for you to treat or to reverse this type 2 diabetes, the first thing you need is to have activated charcoal, commonly abbreviated as AC.
Okay, madam. Maybe where can I find this AC, the activated charcoal?
Okay, nice. Activated charcoal is found all over. In our supermarkets, it's just in a 500-gram tin labeled AC, activated charcoal. In herbal chemists all over, it's found AC. It's actually a worldwide used herbal therapy, so it's easily found. So after acquiring your activated charcoal from wherever the herbal chemists, the supermarkets and etc., take 2 tablespoonfuls of the activated charcoal, place it in lukewarm water which is not warm nor cold.
I understand.
After that, take it zipwise till it's over. After that, take a cup of warm water to cleanse or to clean the system. Then rest for around 45 minutes. After resting for this time, you can have around, let's say around 7:30 a.m., take your protocol juice.
Yes.
As we said, the ingredients, just to follow the same. take the protocol juice and rest for some time. This protocol juice is like an appetizer. Diabetic patients have a very low appetite. So we want to raise their appetite so that they can take their breakfast.
Okay.
So at around 8, that is maybe after 30 minutes, come with your breakfast. What should my breakfast contain? Should it have bread? Should it have mandazi and etc.? No. For diabetic patients, their breakfast should consist of greeny leafy vegetables and whole grain foods. Whole grain foods include brown chapatis.
So there is no tea, there is no porridge?
Because we want to avoid sugars.
Okay.
These are the easily prepared foods. Like you may ask, whole grain foods, like brown chapati, how can it be brown? Yes. You can go to a supermarket and purchase Atamak brown flour. It's all over.
Yes.
Come bake your chapati and your green leafy vegetables. Make sure your chapati are not 10 or are not 20 as we do. Just a quarter piece is enough. And a whole plate of leafy vegetables.
Maybe like skuma, spinach.
Yeah, like spinach and all those black nightshade,
Okay.
etc.
Yes.
After your breakfast, rest for around an hour. After this full hour, take herbal tea. Now this is the tea you are asking about.
Yes.
This herbal tea, as we gave the procedure and the requirements for its preparation, it serves diabetic patients best. So they take breakfast, after 1 hour they take herbal tea and they relax. So they relax for around 1 hour.
Yes.
Do a hot foot bath. For you to do a hot foot bath, just as it hot foot,
Yes.
warm water, place the feet of the patient maybe in a basin, cover the patient fully or wholly using heavy blankets or heavy pajamas, then add the water drop by drop into the basin as the patient takes in warm water, clean boiled water. So do that until the patient sweats profusely. This sweat is a way of taking away those excessive sugars from the body, because as we said, this type 2 diabetes is excess sugars, excess salts and excess fats in the diet. So you're already taking away excess salts. After that, let the patient stay and relax, because that patient will feel very fresh. It has been a routine that when one is sick, we advise fruits and vegetables. But for this case, we don't advocate the diabetes type 2 patients to eat specific fruits which have a high sugar content in them. For instance, a diabetic patient should not use bananas. A diabetic patient should not use watermelons. A diabetic patient should not use apples, because these fruits have a higher sugar content. So these fruits will be used after 1 month of treatment. Reason being, when the medication is on, the sugar content is getting lower in the blood. So after 1 month, you will be taken back to use these fruits. At around 1:30, from 10 to 1:30, let your patient have lunch. And your lunch should not comprise of vegetables if they were included during breakfast. At this moment, you can now get bitter fruits or bitter gourd. So these are like their lunch. Their meal should be kind of fasting, because the body needs to fast so that it can retain to its normal state.
Okay.
So after this lunch, let the patient rest, even in bed, or have a siesta, an afternoon sleep, till around 3 p.m. Now at 3 p.m, repeat the herbal tea, which you administered in the morning.
In the morning.
Yeah, after the herbal tea, at around 4:30 p.m, the sun bath. You understand? The sun bath? Just like a refreshment activity. equivalent to swimming for us.
Yes.
For them, they have a sunbath. At around 6, a light supper. If
Light
possible, only fruits. Just a light supper. And this supper should not be towards bedtime. No. It should be around 6, so that the
6.
patient sleeps at around 10.
Okay.
After that, let the patient have a light supper, relax, watch movies. Then at 8, herbal tea again repeat.
So the herbal tea is very essential.
It's
in
very
this
essential.
process.
So those ingredients for herbal tea should be increased in amount in the house. They shouldn't lack.
Okay.
Yeah, so before sleeping, give them 2 cloves of garlic and onion. Because garlic is like a form of a bitter gourd. Inapunguza makali ya ugonjwa wa diabetes.
But the garlic ndo kitunguu saumu.
Yeah, it's the saumu in Swahili.
Okay.
So let the patient use that before bedtime. And these procedures should go on as the patient uses akitumia yale madawa ya hospitali. Kisha yatapunguza kidogo kidogo. If the patient was using 3 times in a day, you will decrease to 2 times. As time moves by, you will decrease to 1 time. As time moves by, you will cancel the hospital medicines in their diet. It shouldn't stop at once because it may cause an effect to the patient. Yeah. Meanwhile, you should seek assistance from both the health instructor and the doctor because they work hand in hand. Yeah.
So, madam,
Yeah.
maybe the garlic, the kitunguu saumu. Do you boil some water and crush the garlic and place inside and drink the water, or just take the garlic, the kitunguu saumu, and start chewing?
So before bedtime,
Yes.
you boil it in warm water. But for protocol juice, you grind it and have the soup.
Okay, madam. And what if maybe a patient has been using the insulin for a very long time? So how does the patient go about it?
Okay. Maybe the patient has been using insulin for quite a long time.
Yes, yes.
And insulin, as we know it has effects. Like poor eyesight, like added weight.
Yes.
So the best thing for an overweight patient due to insulin
Yes.
in their diet include warm water with pepper or cayenne with lemon. Just drink it at once. It is a bitter gourd, but it's sweet. It's sweet to that patient because we only need healing.
Okay.
Yeah, so for that patient to regain their normal weight,
Yes.
they need warm water with pepper and lemon. Yeah.
Okay, Madam Celestine, you have taken us through the procedure, and at least we have gotten something. So this procedure, is it to be taken only for some short period or maybe a very long period so that this diabetes can be curbed completely?
Okay. Thank you so much for that question. So the procedure continues and continues until the patient is well. The patient himself can or herself can really say at the moment I'm now okay, because it depends with the extent with which the disease had really gone into the cells. So if it was easily traced or earlier traced, then it will take just like a month or for 3 weeks to do away with the disease.
So this will be a normal thing to this patient?
Yeah, it
this
will
is the
be.
only food she or she will be taking?
Yeah, this is the normal.
Yes.
Because it's not the only food, because like vegetables you can change, like the fruits you can change, but there are things which should remain constant.
The herbal
Activated charcoal and the herbal therapies, they should remain constant. This for this procedure to work, it requires seriousness and commitment, because health is the most expensive thing in the world. So we also need a lot of expensive things to come with good health.
So the patient will be going to maybe to the hospital, being tested the level of diabetes in his body?
Yes. Yeah.
Okay, thank you, madam. Okay, maybe To my esteemed viewers, if you have any question to ask about the videos today about the diabetes type 2, you can place your questions on the comment section, and our health instructor here will also address that. Thank you for watching, and let us meet us in the next video.